Today we're going to be presenting on Guillain-Barré syndrome, which is also known as GBS. Today we'll be presenting me, Alex, Sarah Dean, Adrian Ewald, and Bailey Powers. So to start us off, Guillain-Barré syndrome can be called an acute inflammatory demyelinating polyneuropathy. That's a lot. So let's break down all of those words. Acute would be referring to something that's aggressive and actively happening to your body. Inflammatory would be something that is irritated or inflamed. Demyelinating would refer to a loss of myelin. And a polyneuropathy is something that is affecting multiple nerves. So when you put all of those things together, you would have Guillain-Barré syndrome. And throughout this presentation, we will describe more about what Guillain-Barré syndrome is.
So I'm going to talk to us about what it is and the causes. So GBS is a very rare autoimmune condition that only affects 1 in every 100,000 adults. And it's so rare that there's fewer than 20,000 cases a year. So that can kind of put it in perspective for you. While the direct cause for GBS is unknown, it typically appears after a respiratory or GI infection. And this infection will trigger the immune system to begin healing the body through breaking down all the foreign particles. However, with GBS, healthy nerves are mistaken as foreign, and therefore they begin to be attacked by the immune system, which leads to healthy nerve breakdown. So because of this nerve breakdown, symptoms can occur on a wide spectrum depending on the severity of nerve damage.
And so the symptoms that you see in GBS, like Bailey said, they typically start at your feet and then progress up, and a hallmark is weakness that is the same on both sides of your body. So you'll start with like numbness in your feet, and then that will come up your legs, and you can even get tingling of the hands and feet due to the breakdown of the myelin. So the signals are not being transmitted as well, which is the cause for these symptoms. Which you can also get coordination deficits due to the loss of motor and sensory input. And as GBS progresses up the body, digestion and bladder deficits could be seen, the motor aspects of that, and the same with like moving the eyes. So any muscular component of your body is affected by GBS, since it is an autoimmune disorder that circulates through the blood. And in severe cases, it can even lead to paralysis. And so some of these patients could end up in the hospital because they're unable to move their body due to the breakdown of their nerves.
So whenever we're looking at the structures that are affected, we're looking mainly at peripheral nerves. So as Adrian was saying, Guillain-Barré affects bilaterally across the body, the peripheral nerves in a human's body. So whenever a person is diagnosed with GBS, the syndrome will usually target the lower part of their body and then move anteriorly up the body. So to better understand what that looks like, let's look at the picture here in our top right corner of a nerve. So this top picture here is a picture of a healthy nerve, and then the bottom picture of this nerve is a nerve that has been affected by Guillain-Barré. So the axons of our nerves are covered with myelin sheaths that are responsible for more quickly and efficiently transmitting sensory and motor signals to and from our brain. So with GBS, the peripheral nerves and spinal roots are attacked as a result of a false autoimmune response in the body. So the myelin sheath, as you can see here, begins to break down. And so the signal is not conducted like normal between our body and our brain. And this is why a person with GBS might experience limb weakness or tingling, or could even experience flaccid paralysis whenever these lower motor neurons are affected.
So fortunately for this, the prognosis of GBS is relatively positive, with most individuals recovering from the disease with just an occasional lingering weakness. Since most individuals will be hospitalized for a few weeks to months, the most prevalent treatment includes a blood transfusion. And this transfusion just takes healthy antibodies from a donor and enters them into the patient to help stop the body from breaking down healthy nerves. However, if there's not an available donor, the plasma exchange might occur instead, and that's just where the patient's blood is extracted, filtered out of harmful antibodies, and then replaced in the body. And while these are the most frequently used treatments, patients may also be provided with breathing machines, feeding tubes, and various painkillers depending on the severity of their symptoms.
So then just to kind of talk about effect on ADLs and how this applies to occupational therapy, just to start, this affects the patient's ability to feel pain, which you can imagine can be a real safety issue if this person is not able to feel when they're hurting themselves or when something else has hurt them. They also have an inability to feel touch and temperature, which can also cause some safety concerns. So if they're cooking and they can't tell that the stove is hot, that can be a real concern for safety. These patients also have sensory loss. So again, this is a safety concern, again with heat and sharp objects. So because of that sensory loss, they could be putting themselves in harm's way and not know it. They also will experience fear and anxiety about the ability to complete certain tasks. And this can just be caused, from not having that ability to feel pain, having that sensory loss. So they will have some fear and anxiety caused from that. They also could be hesitant to participate in ADLs due to the embarrassment from lack of bladder control. So that's one reason, but also again, they have that sensory loss, so it may be difficult for them to participate in some ADLs. So OT intervention kind of stems around everything that I just mentioned. One of the main important things is education. So education for preventing joint contractures, proper bed positioning, different things like that. Education with the patient, but also with the patient's family or anybody who lives with the patient that will be helping them. Also strengthening exercises, and that could be passive, active assistive, active and resistive, depending on what level they are in Guillain-Barré. And then also doing BADLs. So like I mentioned earlier, they may have some fear and anxiety about performing ADLs, such as brushing their teeth or taking a shower because they do have sensory loss. So this is really important in OT intervention to work on these with the patient and just to help them gain a better confidence in this area. Also fine and gross motor skills, because they do have sensory loss, so this is a really big deal. So just working on that with them and hopefully improving some of that sensation. And then also transfers and mobility tactics, helping them be able to move in their environment and just move throughout their community is also really important. Thank you guys.